COVID-19 disrupting Labor Day celebrations nationwide. Good morning, everyone. I'm Akushla Pinder, and this is your morning edition. But stand by today for the latest on the local fight against the COVID-19 pandemic. That will come from Prime Minister, the Most Honorable Dr. Hubert Minnis, during a press conference later today at 5 p.m., at which time it's expected that the inroads made to fight the disease and where we will go from here will all be revealed. Meantime, the latest COVID-19 dashboard showing an uptick in tests completed. That's now at 2,134. All other figures remain the same. Confirmed cases at 102, recovered at 55, hospitalized at 2, and deaths at 11. A look at global impact puts the number of cases today at 6.59 million cases, deaths at over 388,000, and the recovered at 3.1 million. Well, a pretty short week, meantime, for businesses given the green light to reopen this past Tuesday after being forced to close due to the global pandemic. But many of them will probably tell you what was raked in over the past few days was better than the nothing they were pulling in. This, however, leaves the question of when commercial activity will be further expanded in islands like New Providence and Grand Bahama, considering the progress being made and keeping numbers steady. Lloyd Allen this morning spoke with the Deputy Chief Medical Officer, Dr. DeLon Brennan, who gives us a better idea of where things stand.
From a health perspective, the numbers have remained stable, so we have been encouraged and have been recommending that we could continue along with the phased reopening, giving persons an opportunity for economic recovery, moving along to eventually opening up to visitors coming back to the Bahamas. So we're hopeful that the timeline that's laid out will continue to proceed toward that July 1st reopening of the tourism sector.
And more signs of further relaxation of restrictions. The emergency numbers enacted during the COVID-19 lockdown have for some time been abandoned. Dr. Brennan, can you shed some light on this move?
I don't know if they've necessarily been abandoned. I think what's happened is that we've seen a move toward the emergency orders being relaxed. As the Prime Minister announced earlier that as of today, there will be no longer a requirement that people will need to have a health assessment in order to be able to go to have domestic travel, so to go between the islands. And we think that's a good move. We know that our community transmission numbers have continued to be low here in country, so that's a very positive outlook on what the communities have been able to do, what the health sector is doing, what the policies have done. And that's the results that we wanted. So having sustained those gains over the past, let's say, month or so, I think it's just a natural move for us to be able to move back to, some sense of what we used to do and what normal used to look like.
And also on Tuesday, during the virtual tourism readiness and recovery meeting, it was noted that boat owners attempting to come into the Bahamas may be required to respond to a kind of electronic questionnaire compared to others who would need a full bill of health, basically. Are health officials in full agreement with this format, considering efforts made on the local front to reduce local cases and spread?
I think what we're looking for is the persons who would come in that way. To do it as a paper-based model might be a little bit challenging. So an electronic approach to allowing them to answer those health questions. Many people, if we ask them, especially when it comes to domestic boat travel, to be able to do it electronically before they get to whatever pleasure vessel or mail boat or other conveyance that they're going to go to, may not do it electronically ahead of time. So we realized that we needed to have a backup plan, and paper-based is likely the way we're going to have to go in that instance. So they're complementary. They're not necessarily different from each other.
And also regarding some of those businesses at the tail end of the phased reopening, talk to us about some of the concerns and what recommendations are on the table to improve safety for staff and patrons, but to also get those businesses back open.
I think, when we look at those businesses where people are going to socialize just naturally, when you think about restaurants and the like, beauty shops and barber salons, it's a gathering place. And in those instances, people usually are in very close proximity to each other. And so what we've been advising is that we need to make sure that as we reopen them, we do it in phases. I think from the very beginning, we noted that, when you move to pick up, and delivery. That's one phase of it, when you're starting to talk about being able to come to the actual facility itself and be able to sit down in the facility. You have to do that in a phase, and you may be able to do something, on the outside versus being on the inside, and then transition to something on the inside. With barbershops and beauty salons, you may be able to transition to having appointment-based services first with no waiting at all, and then having social distance with waiting, and then moving to somewhere where, you can have people in a waiting room, but making sure that you adhere to the social distance, the public health matters with washing hands, coming in and leaving, wearing masks. So, just making sure that as you move from one step to the other, we can ensure compliance, and then when everything opens up altogether, you do so in a responsible manner.
And again, just about a week ago, we know that the 2-week lockdown in Bimini had ended. And the last time we spoke, you'd indicated that a team would have been dispatched to the island for sample testing. Any updates there?
We expect to have that sampling completed today, as in Thursday. And so in the next couple of days, we should have results to be able to report at that time. So far, we have not gotten any reports of persons presenting with symptoms that would be suggestive of COVID-19. So at least from the syndromic surveillance standpoint, that has sustained itself, but we are going to wait for some objective testing to be able to tell us on the ground for sure whether the lockdown itself and other activities and public health measures that have been put in place have been effective.